So Dustin and Lacey said, what are some of the symptoms that you experienced or knew something was wrong with your ovary or uterus? I've been having issues for the past 2 years. I do have an appointment coming up, but how do I talk to my doctor about this? What are there any tests that I should ask for? What have others experienced?
So there is a combination of symptoms that we worry about in order to make the diagnosis of ovarian cancer. There used to be a thought process that ovarian cancer was a silent killer or silent disease, but it's really not. And the studies have shown that a combination of bloating, abdominal pain, difficulty eating, or early satiety, and urinary urgency or urinary frequency, those 3 or 4 symptoms, that combination of symptoms, although they're vague in and themselves, but if you have those combination of symptoms, and if you sort of think about your last month or a couple of months and you really can't remember a day without those symptoms, or at least have had those symptoms more than a dozen times each month, then those are all red flags that you need to follow up for. It doesn't necessarily mean you have ovarian cancer. It just means that something's not okay and you need to be checked out and examined, both by a gynecologist and maybe perhaps by a gastroenterologist as well. So, I think that's where your discussion should be with your provider, that you really describe your symptoms and how long the time, what's been the timeline, and if they have been worsening, or if there are any particular triggers that are causing them, and then from that, the provider will decide if you need any kind of testing. Sometimes the patients may need some lab work. Sometimes the patients may need some imaging like pelvic ultrasound, or if they're more upper abdominal symptoms, they may end up ordering CAT scans or referring you to a gynecologist or a gastroenterologist. So all of those are sort of, options, but really sort of needs to be sorted out by the provider who's taking care of you. And certainly I would say that if you're not satisfied with the answers, or something still keeps nagging that something's not okay, pursue it. Don't always, sometimes us providers can be wrong too. So, don't just take, if something doesn't settle well, don't just take no for an answer.
Yeah, that's very thoughtful advice.